For most of us, a leisurely stroll through the park is refreshingly simple. It's a great way to get out in nature, get a little exercise, and some fresh air. We take so much for granted, especially our ability to move about with comfort and independence. However, some people may find themselves bedridden for one reason or another for long periods of time. For them, exercise is every bit as important, but not such a simple task. These people may rapidly lose joint mobility and muscle flexibility, resulting in stiffness of joints and tight muscles, also known as contractures. This can be very serious, preventing recovery and making care far more difficult. However, range of motion exercises, when provided regularly, can help prevent such complications and encourage recovery. This presentation illustrates the techniques used to correctly perform passive range of motion exercises on an inactive patient. These are basic techniques which provide the utmost in safety, comfort, effectiveness, and efficiency for both the patient and you, the caregiver. Patients' conditions will vary, as will their needs. It is up to you, the caregiver, to use precautions, assuring safe and effective care of the patient. Patients with certain hip problems, for example, may not have normal mobility at the hip. Patients with increased muscle tone due to neurological problems will need special treatment. For them, passive range of motion exercises should be performed slowly and deliberately, providing a gradual and sustained stretch, helping prevent further tightening of the muscles. Ask your treating healthcare professional for the necessary precautions for your patient. Passive range of motion exercises should never be painful. If the patient experiences pain, stop the exercises immediately and contact the nurse or other professional who is responsible for the patient. Many bedridden or inactive patients have skin that is unusually sensitive. Their skin may be easily injured with strong gripping and pulling, or may be cut by your fingernails. Use particular care, as damage to the skin of an inactive or bedridden patient can be quite dangerous. Always smooth the sheets before doing passive range of motion. The skin may be damaged by rubbing the body against the bed sheets. Placing part of the body on top of a fold or wrinkle can cause damage. These range of motion exercises should be performed with a patient who is properly positioned on a bed or mat. If you must first move the patient from a chair to the bed, play it safe. Proper lifting and transferring procedures will protect you and the patient from injuries. This presentation will not teach all the techniques for moving a patient into a bed. We will, however, review some key points for proper transfer techniques. If the patient is heavily dependent and unable to stand without full lifting assistance, you should use a Hoyer lift or other such mechanical lifting device. You must avoid the excessive efforts and risk of trying to stand a patient who requires total assistance. Many caregivers and patients have been injured during attempts to transfer a very weak and disabled person from chair to bed without the aid of a mechanical assistive device. So today we will assume our patient requires only minimal to moderate assistance of the caregiver to move from chair to bed. When moving the patient from chair to standing and then to the bed, you must follow certain steps.